About 1 in 10 babies in the U.S. is born prematurely, with Fresno County having the second highest preterm birth rate among California counties. UCSF Fresno, community medical centers, and First 5 California are working together on a more than $6 million project to find a solution. Midwife Brittany Edwards is one of the lead UCSF researchers looking at whether group prenatal care, bringing women together to support each other during their pregnancies, will help reduce stress and make a difference.
We're at a credible time right now. This study will be looking at if group prenatal care does lower preterm birth rates in low-income communities. Group prenatal care itself is a beautiful model that women have used in different places.
Designed to enhance patient education and provide emotional support, group prenatal care is improving birth outcomes.
So this group model has been utilized in different places across the country and has not been utilized until recently in Fresno. And so we're excited about this opportunity to see whether group care or individual care is actually best for our Fresno residents and our community.
The 4-year study, named Embrace, for engaging mothers and babies, reimagining antenatal care for everyone, will analyze 2,600 women, 1,300 for group care, and 1,300 for individualized care. The study started in November of 2019 and has already one group of mothers give birth to healthy babies.
And we'll be looking at these outcomes. Does group care decrease preterm birth? Does it decrease depression and anxiety? How are the experiences of women who are in group care versus individual care? Are they respectful or disrespectful experiences? So with focusing on experiences of Black and Latina women, and we know that African American women have the highest rate of preterm birth, far passing their white counterparts and even Latina groups and members, and consistently it's been that way.
Darnisha Wiley Scott gave birth to her baby boy Maurice in November of 2019. Being a woman of color, she knew she was at higher risk of having her baby too early, so she was willing to be part of a study that could make a difference.
I was very skeptical about the care and the information I would receive in a group prenatal care environment, but after attending, I loved it. I loved it a lot. You try to be as positive about carrying your baby in an environment that's not so welcoming of your baby at the first place, you know? So again, going back to my first thought, being in a group prenatal care setting really definitely helped that stress to be lowered, because like I said, I have the love and support not only of my healthcare providers but of the women around me. You know, it's a sense of community.
Premature babies, especially those born very early, often experience ongoing medical complications that affect the whole family. The prenatal group is designed to be a safe place for a variety of topics, especially difficult ones.
And these are topics that if somebody had asked me before we started group care that these women would be so open to discuss this, I would have said, absolutely not. Everybody's going to sit there. And what happened was exactly the opposite. It was like the floodgates came open. And they're talking about their relationships, and they're talking about potential substance abuse, and they're talking about violence in their neighborhoods, to the point where I was just sitting back thinking, wow, this is amazing. And I think when you get a group of women together who in many ways feel isolated, they start supporting each other. And many of them don't have families near or close.
The group care setting involves 8 to 12 women getting together for their regular prenatal checkups, and then, for a 2-hour span, sharing their stories and concerns.
In addition to that, we provide free childcare. We provide groceries. We provide transportation reimbursement so that we can get these ladies, reduce some of these barriers to get these ladies together. In addition to that, we surround them with community services. So we have different people that come in to speak, and that can be behavioral health from Fresno County, because again, mental health issues and stress and all of those things are very important during pregnancy, because we know stress increases prematurity.
The goal of the group model project is to improve the health of moms and babies and provide maternal support. Additionally, its goal is to help providers become more educated, improve prenatal services in our community, and help reduce and eliminate preterm birth and infant mortality.
It really is a community that's built, and from this group model we're seeing in other places, there is a decrease of preterm birth, there's an increase of breastfeeding rates, there is an increase in satisfaction, and so it's a real opportunity to actually have evidence now through this Embrace study to see, does it also work here for us? We really want to figure out what is going on here, and this opportunity we have to make a change and do it together.
If you are pregnant, ask your doctor about participating in the Embrace study. And if you are interested in partnering on efforts to reduce preterm birth, reach out to Embrace at mail.fresnostate.edu or call 559-228-2165.